On Doctor's Diary, this is a story of a doctor with diverse talents and passion.
My name is Dr. Patrick Gatonga.
By the time he was graduating from medical school, he had 3 degrees, 2 bachelor's and a master's degree.
It may sound a bit absurd. I felt quite idle as a senior medical student.
At only 34, Dr. Patrick Gatonga is the current Chief Executive Officer of Jubilee Health Insurance.
I had had a lot of interest in healthcare, but continuously I felt there was more than just the hardcore medical practice, which is something I really enjoyed. But at the same time, I felt I needed to do more, or I felt I could do more than just that.
He is a doctor driven by a purpose in healthcare, but he still finds time for his other passions.
Music is like a language that expresses how you feel. I'm the CEO of Jubilee Health Insurance, which is a subsidiary of the Jubilee Holdings Group, specializing in health insurance. It's a very long journey, very long and windy journey. They have 4 siblings, all boys, so you can imagine how wild the childhood was. And we grew up in in Maasai land. That time it was very scarcely inhabited, especially in the early 90s. So we had a lot of space to, go do all sorts of crazy things as boys, from hunting with dogs to, the playing in the fields, farming. My parents were involved quite a bit in farming, subsistence farming, and we were basically the labor for that. I had a very unusual beginning, especially with schooling. I didn't like school very much, so I actually skipped some years of nursery school and all that. I just couldn't stay at school. So by the time I was settling in school, I was I was much older than the rest of the kids. So I had, I'm not sure what arrangements they made, but I skipped some classes. But fortunately, I managed to catch up. This was back in the early 90s, Narumoru Primary School. So that's why I schooled up to about standard 7. And after that, I got some, local scholarship into one of the local private schools around the area. At Starehe Boys Center. I went in just like an ordinary student, but it was one of the most fulfilling 4 years and enriching 4 years in terms of the education I went through. It wasn't just about learning, but it was really about growing, and getting to really getting exposure into not just in the academic world, but also in other things, developing life skills. I would say it's one of those experiences that really opened my eyes, especially having come from a very rural community. It sort of opened my eyes into the global world. I would trace my thoughts on medicine back to, when I was probably about 13, 14. When my mom fell ill, she was diagnosed with rheumatic heart disease, which is almost like a lifetime condition. And she went through a lot of difficulty. At that age, I couldn't understand what exactly was going on. But I had known her to be very healthy. She was a typical, rural person, very active in the shamba and all that. And for a period of about 6 months, she was bedridden, and we couldn't quite figure out what was going on. She went from hospital to hospital, eventually found her way to Kenyatta National Hospital, and that's where she was diagnosed with rheumatic heart disease. And I remember having a conversation with her. It was actually, we were sitting somewhere outside in the shamba, and we were sitting under some banana trees. I still remember that specific spot whenever I visit. And she asked me what I wanted to be in the future, and I wasn't very clear. Just a typical child, not too sure what they want to do with all sorts of ambition. And she told me about her condition and what she went through. And immediately the thought of becoming a doctor in future, started developing. And I particularly developed a lot of curiosity around cardiology, having seen what she went through. So I think that for me that is what sparked my curiosity around medicine. So I joined medical school around 2005. Initially, I wasn't very clear that I wanted to go into medical school. I had taken a gap year, so I got a scholarship to take what is called a gap year in Australia, which again was a very interesting and eye-opening experience. Initially, I had thought of studying medicine out of the country, but after exploring various options, I felt this was a more appropriate environment to study medicine, especially given what I wanted to do, and also being closer home. After the first 2 years, I had an opportunity to also take an additional course. So I also studied human anatomy, and out of that also became part of the faculty of the university, and that also opened my eyes quite a bit. And developed a lot of curiosity in me. I would say that's when I started developing a lot of business ideas. I interacted closely with faculty, and we had very interesting engagements around purpose and such issues. It was more than just a normal degree course. And after completing my studies in human anatomy, I went back to continue with medical school. And right after that, after going back to continue with my medical studies, having come from a very high pressure environment, I felt quite idle. It may sound a bit absurd. I felt quite idle as a senior medical student. We tried together with a few friends of mine setting up a media company. It was a big failure. We had very lofty ideas that required quite a bit of capital, but also a lot of time. I wouldn't say the challenge was so much capital. It was really time. And I think we ran it for about a year. We were trying to create a channel that focuses on breaking news across the continent. So I'll play the opening of a piece by Mozart. It's called the Sonata in A by Mozart. And it's a very expressive, beautiful beginning of it. Of course, it builds up into other things later on. But just listen to it. I also ran a music school when I was a medical student. I studied piano in high school, so and even post high school, I played a lot of piano. Unfortunately, I don't play much anymore. But through that experience, and music has always been very, something that's very close to me. So I ran a music school at the same time when I was at university. I felt a bit curious to also study business, and I think it was more also a way of balancing my life with all the idle time I had as a senior medical student. So I took up an MBA at the same time. It was a bit of a rough ride. I had a lot of time to spend in classrooms during the day in medical school, in the evening again in an MBA program. But that went well, and eventually I graduated with both degrees. So we had this graduation booklet where they would read the list of graduating doctors, and then when they go to the business side, they would also read the list of graduating MBAs, and I was on both lists. It was a bit of a unique and unusual thing. So I graduated with a Bachelor of Science in Human Anatomy, in Medicine and Surgery as well as a Master's in Business Administration. I finished my upper primary schooling through a scholarship. Went through high school again through the support of sponsors. I don't think I would certainly not be where I am And there are also things I learned through that experience. One also is self-sufficiency. I had to learn quickly that you can't just keep relying on help. That you have to find ways, you can only be helped up to a certain point, but you have to pick up yourself and find your own ways of, self-sustenance. And also make sure that you do not disappoint those that have put their resources to support you. As they say, to those whom much is given, much is also expected. So it also gives you a sense of responsibility that at the end of the day you also have to give back. And it also teaches you that life is not about looking for example after financial wealth. It's got to have a purpose. And when I reflect upon those who supported me to get where I am through their resources, sponsorships, and scholarships, you actually see a very strong sense in or strong spirit of giving and having a purpose. I felt I needed to do just more than medical practice. So I moved to Kenyatta National Hospital as an intern, but I still felt the urge to do more and more. I didn't study all that just for the sake of it. I had always felt there was a gap in healthcare that wasn't as clear to me at that time as it is now. And mainly around leadership and management of healthcare. I had had a lot of interest in healthcare, but continuously I felt there was more than just the hardcore medical practice, which is something I really enjoyed. But at the same time, I felt I needed to do more, or I felt I could do more than just that. So as I was doing my internship at Kenyatta National Hospital, I also got in contact with AMREF. So I worked at AMREF as a consultant. I had done a lot of research throughout university, so I was quite, well versed with, public health research, management research, and things like that. I would say that's where I really, started getting the sense of what I really wanted to do much later, which is, play in the interface of healthcare. But applying business principles. And at the end of it, my interest narrowed down to development, but not development in the old sense as it's known, because the focus was really around how do we improve health outcomes, and how do we make people more self-reliant and more protected from a healthcare perspective. The more I realized that couldn't be done sustainably without also creating enterprises that have commercial value out of them, but addressing the same problem. So I developed a lot of curiosity around, what can I do within the business world that creates development impact. And since that has, been a mission I've been throughout my jobs and all that. It's been at the core of what I've been doing. So I worked briefly at AMREF. Then they came across an opportunity with a global management consulting firm, McKinsey and Company. By that time, McKinsey had quite an active practice in Africa, but they were mainly based in South Africa. We also had offices in West Africa and some parts of North Africa, but no presence in East Africa. So because of that, I had to travel quite a bit. I had to, leave the country briefly. I worked in South Africa, and I got exposure to various other sectors. Working as a management consultant, worked across the continent in different kinds of sectors, worked in banking, I worked with private equity firms, in the public sector quite extensively. Majorly in the southern part of Africa, the Middle East, and also West Africa. So I am currently married with one son, and it's my closest support system. By the time I joined McKinsey, we had just gotten married. So I felt that, the traveling and all that, I needed to settle down a bit. So I moved back to Kenya, and they worked with UAP Old Mutual. I was hired as to look after the commercial side of the business, really around strategy. And at that point, UAP and Old Mutual had just merged, and we had a struggling health business. That my mandate was basically to figure out how we could turn around the business into profitability. That worked successfully. My focus right now within the business is to look at how we can address particular issues within healthcare. One of those, the core of that being financing for healthcare, or financing healthcare risks. I think it's at the core of our economy, because for us to have a productive population and achieve the economic goals we have as a country, we must have a healthy population. We have to figure out a way to keep our population healthier, and sustainably so. But keeping a population healthy comes at a cost. And it's difficult to finance that solely through government funding, or donations. I think it's time we started looking at healthcare as a real economic driver of our country, away just from being a social sector. I think at the core of that is figuring out how we can make health financing sustainable, because that's it's partly what makes access very difficult.
What are you most proud of so far?
We were a team of 4 people that opened the Nairobi McKinsey office, and now it's grown into a regional office. It was a really challenging experience, almost growing an international organization from scratch within a region. I've also had very good experiences at Jubilee. We've pioneered a lot together with my team, creating new things, trying to do insurance in different ways. There's still more to be done. I'm still leading the team there, and I think there's quite a bit of in store. So I get a lot of surprises. Not so much now, but before, including within my own family. It was difficult for even my own family to see the logic behind some of the decisions I made. Once you go into medical school, everybody expects you to be a practicing doctor thereafter. After studying human anatomy, even my own colleagues, it was almost a guaranteed surgical journey from there. The one skill I really gained with the study and practice of medicine is structure. And solving problems. I think it really intrinsically teaches you how to find a solution to a problem. Even looking at how doctors will sit with a patient and listen to the symptoms the patient has, dig a bit further to really understand the problem, investigate and all that. I'm a very outdoor person. The wife keeps saying I can't sit still in the house for more than, for even half a day.
So working from home doesn't work for you?
It does, but I have to get out. To be honest, I actually don't think it works very well for me. I always find myself out of the house. When I have a chance to, I'll spend time in camping. I'll spend time hiking. And one of the outdoor experiences I really enjoy is golfing. I think the golf course has a way of just calming you. And it also teaches a lot of patience. You have to be very patient when playing golf. And it has its own surprises. So it also somehow forces you to learn to, accept disappointments. My son is now 3 years, so he's starting to pick it up. So, it's also a nice way for us to bond. It moves your imagination. Music is a huge part of my life. Interestingly, before I joined medical school, I was actually offered a scholarship to study music by the government of Kenya. I began music in earnest in high school. And it sort of became a very natural thing for me. So, it almost became my second nature. Right from my first year in high school, when I started, studying the piano, I somehow picked it just naturally quite well. And mainly, I played and studied, mainly classical piano and classical music. And after studying piano, I also took, interest in conducting and directing music. I still do that on a part-time and voluntary basis.
You're now a CEO of the health business. Is there anything more? What next for you?
Any job you get or any opportunity you have to provide some, to provide your skills, it's really a platform. And that platform has to be used for something bigger, not just for that specific role. So for me, it's a platform to create some of the changes I think need to be created, to influence, for example, right now, conversations around what needs to happen in healthcare.